I'm Dr. Justin Schweitzer, a primary care physician and medical director for LGBTQ Health here at Cooper University Healthcare. I honestly had my first patient ask me to manage their hormones, and this was a few years ago in 2017, and I didn't know much about it, and I took it upon myself to start learning how to prescribe and manage gender-affirming hormone therapy. And it's honestly been one of the most rewarding parts of my career. I had approached Cooper's leadership and I said, this is an idea that I have. I really like it to stay in South Jersey. I'd like it to be in a certain community. Cooper, loved the idea. They wanted to collaborate with me and improve on that. And that's how the Center for LGBTQ Health at Cooper came to be. It's nice to be able to provide, lots of access for patients. We can typically get them in with only, a day or two's notice for primary care service lines, and then we've got our specialty providers that are able to kind of further support our patients when needed. Some of the services Cooper offers in regarding LGBTQ health include mental health providers, and they're able to do either 1 or 2 time assessments for gender-affirming surgery if it's typically required by the insurance company, or if a patient feels like they need ongoing mental health support, counseling, and therapy, they're also able to provide that as well. We have a great team of top surgeons that work with our plastic surgery team for top surgery for trans men. We've got an endocrinology team if we need it for gender-affirming hormone therapy, but we also have a primary care provider network that is experienced with prescribing gender-affirming hormone therapy as well. So we are informed consent. It could be a verbal informed consent. We do have a physical form to sign as well. We have urology, helping to manage bottom surgery complications and orchiectomies. We have trans-friendly OBGYNs. We also have a group of doctors that are doing prep for HIV prevention, including teleprep, or if patients prefer to come into the office, we could see them for that way as well. Our EMR system respects patients' gender identity and chosen name, so that's able to be reflected in patient charting. If the patient is calling up our call center, they will see the chosen name and preferred pronouns. When the medical assistant brings the patient back, that information is also displayed, so it kind of makes that whole process a little bit more seamless and better for the patient. So say if they need to go to urgent care or the emergency room or to see an orthopedist, right? We want everywhere that a patient goes at Cooper to be LGBTQ friendly and inclusive. Part of that is the EMR capturing that information, but part of it is also having training to be more culturally competent when it comes to this community. I've been lecturing to residents as well as other physicians about trans health, gender-affirming hormone therapy, and we're getting together some training from a human resources standpoint to train our staff. When it comes to the way that Cooper is handling, so to speak, LGBTQ patients, I think that they're doing a great job, and we're doing our best to do an even better job. For anyone looking for LGBTQ+ competent care, we welcome you here at Cooper University. We have a great team of primary and specialty care ready to meet your unique needs.